Hi, I'm Dr. Mike Maguire, and I'm very excited about a new medical specialty. It's called lifestyle medicine. I think this new specialty, lifestyle medicine, is going to change healthcare in the United States over the next decade. And as my patients and friends, I'd like to bring you up to date on what it is. It's impossible for me to do this in a 10 or 15-minute office appointment, but I want to explain this new exciting specialty to you today. So first, let me give you a definition of lifestyle medicine. Here it is. Lifestyle medicine is an evidence-based medical specialty that focuses on preventing, managing, and often reversing chronic diseases through therapeutic lifestyle interventions. It is built on 6 interconnected pillars that guide its practice. Before we take a look at each of these pillars in depth, let me go over how medicine is currently being practiced in the United States in 2025. Currently, we're spending twice as much on healthcare for every citizen compared to any other country in the world. And are we getting twice as good of outcomes? Unfortunately, the answer is no. We currently rank 47th in lifespan in the world of the over 200 countries. We're currently spending 8 out of 10 of our healthcare dollars on chronic diseases that were not in existence or were quite rare 50 years ago. And for the first time, this generation of children will statistically live a shorter lifespan than their parents. If that isn't bad enough, let me tell you where our healthcare providers are right now. Currently, estimates are that 50% of healthcare providers, primarily doctors, have suffered or are currently suffered from burnout. And up to 25% of our medical students admit that they are suffering from depression. We currently screen for cancer in the United States, but we don't teach you how to prevent cancer. What do you think, what percentage of cancer do you think can be prevented through lifestyle? Well, it's about 50%, or it's probably even better than 50%. But when was the last time your doctor told you how to prevent cancer? He's told you to have a mammogram or a colonoscopy, but is he teaching you how to prevent cancer? That's my job. The biggest and scariest thing to me about the healthcare in the United States today is the gap between our lifespan and our health span. Currently, our lifespan is around 78 to 79 years in the United States, but the gap to our health span is about 13 years. What does that mean to you? That means that the last 13 years of your life, you will suffer from at least one chronic disease that is in some way debilitating. Like what? Well, that could be cardiac disease that makes it hard for you to walk from your car to my office because you're short of breath or you have chest pain. It could be lung disease that causes you shortness of breath. It could be neurologic disease that makes it hard for you to even walk or hard for you to remember what you had for breakfast this morning. Did you know that recently there has been a study that shows that Alzheimer's disease in its early stages can be prevented or reversed? Lifestyle medicine is currently doing that, but the education is not getting out to you. So let me tell you what those 6 pillars of lifestyle medicine are. Let me define them for you. Pillar number 1 is optimal nutrition. Definition is encouraging a balanced diet rich in whole foods while minimizing processed foods. We realize as physicians that 73% of Americans' calories today on the average come from processed foods. These are basically unhealthy foods. Let's move on to pillar number 2. Pillar number 2 is physical activity. Physical activity definition is promoting regular exercises tailored to the individual capabilities and preferences. We know that we have to tailor exercise to things that you like and things that I like. If I don't like the exercise I'm doing and I'm not feeling some benefit, I'm not going to do it, period. Pillar number 3 is restorative sleep. Definition of restorative sleep. Emphasizing the importance of quality sleep. We all know that we need good sleep, but we need to define it and we need to optimize our sleep so we can live the best life we can live. Pillar number 4, stress management. Definition, teaching techniques to manage stress effectively, such as mindfulness and relaxation strategies. We're all faced with stress every day. There are ways we can deal with it and ways we can make our life better. Pillar number 5 is connectedness. Definition of connectedness, fostering social connections and support systems to enhance our mental and emotional well-being. I've been fortunate enough to hear a professor from Harvard talk about happiness. And he used the term connectedness often because connectedness is the single most important thing to have to maintain or reach that goal of happiness. We need to learn more about connectedness. We can all do it better. And finally, pillar number 6 is avoidance of risky substances. Definition, encouraging the avoidance of tobacco, extreme or excessive amounts of alcohol, and other substances. I'm optimistic today in 2025 because we have medications and strategies to help people stop smoking, decrease intake of alcohol. If they're a binge drinker, we have medications that can help that. We have treatment programs that can treat alcoholism and treat other substance use disorders. We can help patients today. Let me finish with this. Some of you may know what the word doctor, or where the word doctor came from. It came from the Greek word teacher. My job is more than prescribing you a medication or making a referral to a therapist, a physical therapist, a psychological therapist. It's providing you preventative medicine education. That's very difficult for your doctor to do in a 10 to 15 minute medical appointment. That's why I want to take the time to, with you, revisit these 6 pillars. My personal health goal is to make my health span reach as close as I can to my lifespan. And believe me, I'd like to make my lifespan as long as I can. I talk to patients every day and I feel that their desires also align with my same long-term goals. I think we can all achieve this. I think we can bring our health span closer to our lifespan, and I think we can do it through the 6 pillars of lifestyle medicine. I hope you will stay tuned, and we'll go through these pillars one by one, and we'll try to achieve those goals. Thank you.